also Gauteng has recorded close to 8,000 new COVID-19 cases in the past 24 hours. The province has seen the highest numbers in recent weeks, mainly driven by the Omicron variant. Joining us now to discuss this is Profesor Bruce Mellado, who is a part of the Gauteng Coronavirus Command Council, and Dr Sipho Dhlamini, and an infectious diseases specialist. A very good morning to both of you, gentlemen, and thank you for your time. Dr. Dhlamini, let me start with you. So what we do know about Omicron is that it's highly transmissible, yet we are hearing that more needs to be discovered. Just remind us, what is it that still needs to be known about this?
Yes, good morning to Dizila, and good morning to your viewers. So we've got this new variant, Omicron, as has been given the name for it. It looks like it's highly transmissible, and that is true. What we don't know is whether this will behave very differently compared to the other variants when it comes to hospitalization and even deaths and outcomes. So at this point in time, all we know is that it is highly transmissible. We have not seen any indication that it is causing more deaths or leading to exponential increases in hospitalization. So that is data that we are looking for to see how it behaves in the community, in our hospitals. So that data is still outstanding.
Professor Mellado, I beg your pardon, with what Dr. Dhlamini has just said, what considerations does the National Coronavirus Command Council make as we see an uptick in the number of infections as a result?
First of all, thanks for having me. So I'm a member of the Provincial COVID-19 Advisory Committee, and we basically deal with questions of the province. As Dr. Dhlamini very correctly pointed out, it seems evident that this virus moves very fast, transmits very fast. Now, of course, this probably is the result of different degrees of intrinsic transmissibility or escape reinfections. These things now are embedded into the modeling, and that's what we basically do. That's what my team essentially does, is collect all the information that comes from different sources, different stakeholders, and the data to come up with projections that can help policymakers deal with this crisis. Now, as Dr. Dhlamini correctly has pointed out, we see, as we have seen before, a delay between the number of cases being declared and hospitalizations and mortality. Now the numbers of hospitalized people are now picking up. We now have statistically a compelling data samples that we are able to look into carefully to assess what the next question really is, how virulent and how prone this virus is to severe disease. That's an extremely important question that with the data that we're going to get this week and most likely next week, we'll be able to clarify and shed light on. So now we have very intense rounds of consultations with different stakeholders, including, very importantly, our clinicians in the province, to give us an understanding of what really is going on the ground and how their perceptions correlate with the numbers that we are getting and are streaming in as we speak.
Professor Mellado, with these consultations, I'm curious in terms of recommendations whether there will be a lockdown or not. That is rife in terms of speculation, right, in the country. A lot of people asking themselves, well, will we go into a lockdown as a country, or are we going to be looking at specific provinces like Gauteng, as we report, having the high number of cases?
I believe this sort of policy-making questions will come, we put on the table and will be discussed a bit later. Now we have a wealth of data and information that we are processing very fast, that we are running analytics with, and that will allow us to establish what is the level of severity that these large numbers are providing. We have early indications, as already Dr. Dhlamini indicated, that we have somewhat of a different pattern of severity, different patterns of hospitalization, different demographics, and so on. We also see that most of people that are hospitalized are unvaccinated, where people that are not vaccinated are in a minority. We have those early indications that allowed us to come out and say, vaccination works, keep doing it, this is very important. But now we're entering a phase that we have a lot more data where we can be more quantitative and more concrete as to what the level of severity that this wave is bringing in, and as a result of that, policymakers will act correspondingly.
Dr. Dhlamini, on the issue of vaccination, so this weekend was government's Vuma vaccination drive. We heard from the premiers of Mpumalanga as well as KwaZulu-Natal bemoaning the low numbers of people who are coming out to get vaccinated and literally pleading with South Africans to come out in their numbers to vaccinate. What have you observed or made of this observation?
No, thanks to Jessica. I think we welcome the efforts made by our provincial leaders and government leaders in encouraging people to vaccinate. I think that is certainly, I would say, for government a key priority now going into the next few weeks to really encourage people to vaccinate. And I think what we need to do is to give people the confidence to come out and get vaccinated. I think we haven't given our people the confidence that the vaccines that we have work. As you can see, we're sitting just over 46% of the population being vaccinated. I think it's critical that in the next couple of weeks we continue to preach the message of vaccination because vaccines do work. And certainly, we call on all stakeholders. So, not only just government, communities, our religious leaders, academics, and certainly communities. So, you and I need to encourage our family members to vaccinate. And I think we just need to help people get the confidence that the vaccines are available and must be used.
What does this confidence look like? I ask you, on the weekend we were speaking to the SRC of the University of Johannesburg, which has introduced mandatory vaccinations. And some of the points that have come out from young people particularly is that they would like African science to be included in this process, saying, some people take mhlonyane, for instance. I failed to find the English word, but such conversations are also happening. So what does this confidence look like?
Well, confidence is giving people the right information and education. So if people know that vaccines work, then they'll be confident that they will use them. So, you go to your shop with your R1 in your pocket and you give it to the shopkeeper. The shopkeeper is confident that your R1 is good for. So that's the confidence we're talking about, that people will accept the product and are happy to use it. And I think what that requires is just giving people the right information and therefore people then make the right decisions once they know why they're getting vaccinated and what's the point of being vaccinated. So that's the confidence we're talking about, where people are able to take the vaccine with confidence that it's going to work to protect themselves and to protect their loved ones and the community.
Dr. Sipho Dhlamini is an infectious diseases specialist. Professor Bruce Mellado is part of the Gauteng Coronavirus Command Council. Gentlemen, thank you.